And we are live. Before we start, as usual, guys, I'm going to give the house rules first and foremost. I don't know if foremost is a word, but anyway. Please use the comment box in both YouTube and Facebook. They are there for you guys to give us tips, ask questions for the guest, and will be looking into it for us. He's today our tech guy for today. Also, this show will be available on YouTube, and on Facebook as well. So if you missed it today, that's absolutely fine. You can always watch it again in the future, and also you can share it because you can always access the link, and it's always there for you to watch. Also, we will be trying to turn it into a podcast. I know we always say that, but it is going to happen. And the last one is that the program will be about 1 hour long.
Hello.
Hi. Me too.
Welcome to PMP with PMP. I'm Phil Samba. My pronouns are he, him. I am a black guy with dreads, a blue background, and a green t-shirt.
And I'm Pedro Lino. My pronouns are also he, him. And I'm wearing a black t-shirt with some blue stamp that explains a bit of combination prevention. My background is green. I'm wearing glasses. And yeah, that's me.
We both work for the Love Tank, which is a non-profit organization promoting the health and well-being of typically underserved communities.
PNP is a space in which we can discuss different topics within sexual health that we don't normally talk about. And when we say sexual health, we mean your state of physical, emotional, mental, and social well-being related to your sexuality, not just the absence of disease.
So this is our 6th episode, which is our final of this season. And every episode has a different theme, and we hope that they will not only inform you, but empower you. We'll have a guest for most episodes, and today at the end of the interview, we are going to give away a gift for one person who is willing to participate in the tier system.
Yeah, for today's topic, today we're going to talk about PEP. PEP stands for post-exposure prophylaxis. It is a medication that you can take if you have been at risk of HIV infection. The course lasts 28 days, and if you take it within 72 hours of being at risk, it may be able to prevent you from getting HIV. The best place to go for PEP
is a sexual health clinic, typically only open during the week. Sorry.
You go, Phil. You're right there? Okay, I'll take this one then. The best place to go for PEP is a sexual health clinic, typically only open during the week, during office hours. If you need PEP over the weekend outside of office hours or during a public holiday, the best place to go is the accident and emergency department of an hospital. A&E departments never close, but there is no guarantee that an A&E doctor would agree to give someone PEP. Phil, are you with us, or you have gone? I have the impression that Phil is not among us anymore. So we'll take his place while we keep his beautiful face frozen there in the middle sandwich. It will be the filling of our sandwich.
Hi, Pedro. I'm Will. It's lovely to be with you. And I was there doing the tech stuff with behind the scenes, but it does look like Phil has a little bit of a tech problem. Let's hope that I don't have one as well. So, Pedro, you were asking, have I ever been on?
Yeah, I was going to ask Will, but have you ever been on PEP? Oh, Phil, but have you ever been on PEP, Will?
No, I haven't. I have certainly had a situation when I went to find out if I should have PEP. I can remember it was actually, here's the irony, I was at an HIV conference in Canada, and I went to a sauna, and I was really drunk, and I had sex in the sauna that potentially exposed me to HIV. So I went into the conference the next day, into the medical center, and I decided that I wanted to work out if I was going to have PEP. But actually, I did a risk assessment with a fantastic doctor there and decided that I was not going to have PEP. So I tried, but didn't happen. What about you? Have you ever had PEP, Pedro?
Yeah, I had PEP once. It was a similar. No, it wasn't a similar situation, but well, what happened was I went out with this guy and we had sex, unprotected sex, but he didn't come inside of me. It was just, he was just checking, and then I felt so worried the next day. So it was in Brazil at the time still. So I went running to the surgery, and I told them, hey, I heard about prophylaxis, does that exist in this country, and what can we do? I'm worried. And they explained that was fine. And after as well, I had the same situation in the UK, and I went to Dean Street, but they said that they had done a risk assessment, and they thought that I should be fine, and I was fine. Yeah. Phil, you're back, right?
I'm back. I'm sorry.
Phil's back
again.
Phil's back, so I'm going to leave you guys. I'll see you in a little while.
Thank you, Will.
Bye-bye.
Thank you.
Bye. How about you, Phil? Have you had PEP before? I heard some stories. I had rumors.
I have been on PEP before. At the times, I've been on PEP twice, and during the time that I was on it was at a time where you had to self-source and buy it online, and I actually didn't know that much about it. And I can't really remember how I even knew about PEP and PrEP. I think I remember it through word of mouth and having conversations with friends. So yeah.
Yeah, and on that note, interview time. So we'd like to introduce our guest, Monty Junejo. I hope I'm saying your surname correctly. And allegedly, according to Monty's Twitter, he is a medical doctor, a researcher. He can be found at the intersection of dermatology and sexual health. He is for health equity, is a third culture kid, is trilingual, and his pronouns are also he and him. Welcome.
Thank you.
Thank you so much for joining us. How are you?
I'm well. How are you guys?
I'm good. Minus the technical issue we just had. I'm good.
That's fine. So that's fine.
Could you?
So before we start, you go.
Could you give us a short audio description of your background and what you look like?
What I look like?
But behind you. It's for people that are audio-visual impaired.
Okay, so I am wearing a burgundy shirt, and I've got a olive green wallpaper behind me.
Yeah. So the first question, I'd like to do this first question because there's a lot of confusion between PrEP and PEP. So before we actually start, could you please, Monty, explain to us what the differences are between them, both of them?
Yeah, of course. So I think if we break down the names, it's kind of easier to talk about what they are and kind of understand. So PrEP, as most people probably know, is pre-exposure prophylaxis. Prophylaxis means that you can take something to prevent something else. So in this case, to prevent HIV. Whereas PEP is post-exposure prophylaxis. So you take that after you've had a potential exposure. The drugs that we give in PrEP and PEP are kind of similar, but not exactly the same. But that's the basic difference.
Yeah. And can you get PEP from your GP?
No, you cannot. PEP is like an emergency drug. That's why it's available at A&E and at a sexual health clinic. GPs wouldn't necessarily have PEP. Also because it takes so long to even get a GP appointment these days. So it's not that convenient, I suppose, to have to go to a GP, wait 10 days and get PEP because it won't really work.
Yeah. And because of that, do you think it should be offered at pharmacies? Because then it would be much easier to get to it.
Well, I think it's important to be able to see a clinician, whether that's a nurse practitioner or a doctor, to have a proper risk assessment and to go through your other medications, if you're on any, and how they might interact with the medication. And at the end of the day, I mean, A&E, like you said in the intro, is open all the time, and you can get PEP at A&E. So no, I don't necessarily think it needs to be at the pharmacy, but it is something to consider. I guess I've never really thought of stocking PEP at a pharmacy, to be honest. I know that, like, it is actually quite easy to access.
Yeah, because then, if like in a case like mine, if I feel worried, I could just go to a pharmacy and get the drugs. But I don't know if it's a situation that will put me in danger for having the medicines, you know, or for having PEP.
Well, not really. I guess PEP's quite a harmless drug in many ways, but it can interact with certain common kind of medications or supplements that people take. So like vitamins and other supplements, you know, and I think also the dosing is really important. So like to have a very strict regimen for when you take it. And I think there's a lot of, and then discussing follow-up, etc. That's also quite important. And, you know, the reason for PEP, sometimes it can be a non-consensual episode, in which case, obviously, well, that might be beyond the scope of a chemist or a pharmacist's kind of expertise. So I think it's good to have someone who's specifically trained in dispensing and talking about the situation and doing a proper risk assessment and counseling to be able to kind of dispense that, which is also one of the reasons why A&E only gives you a 5-day pack. So I don't know if the audience knows or not. So PEP is a 28-day course, and you have to be very strict with the timing. From A&E, you can get the first 5 days, but you can't get the other 23 days. You have to go to a sexual health clinic and tell them, look, I got the first 5 days from A&E and I need the other 23 days. And then they'll obviously, again, risk assess and counsel you, et cetera, et cetera. And I think that in a way is quite a good thing, because it encourages people to engage in testing, like a baseline screen, also to see if there are any other kind of non-physical needs that might need to be addressed. You know, if there was a difficult situation which required the use of PEP, if people have, if people are using recreational drugs and are struggling with that, so that kind of thing. And I think in a sexual health clinic, you're very well equipped with health advisors, doctors, nurses, to be able to kind of provide a really holistic consultation.
Yeah, you're saying that it's a good thing that they only give the 5 days on A&E, but I don't know. I feel like maybe you could also have the risk of the person not going to the sexual health clinic and just stopping the treatment after the 5th day.
Well, so when the A&E doctor gives the PEP, they will tell them that you need to go to a sexual health clinic to get the rest. And I think at some point we also have to, like, you know, assuming these are adults having sex, we have to kind of take into account that people need to take responsibility for their own health a little bit. And, you know, having the rest of PEP in a sexual health clinic is, you know, in the long term beneficial to these people, because you'll get tested. They'll encourage you to take PrEP if it's appropriate. They'll talk about risk reduction strategies. So I see what you mean, but I mean, at the end of the day, I think if you know, you're coming for PEP and you know about it and you care enough to, you know, go to A&E out of hours and get a 5-day course, then surely you're motivated enough to get the rest of it.
Yeah. You were saying that the period, the course of the PEP is 28 days, and also the window for starting PEP 72 hours, right? But how soon can I start taking PEP? Let's say I had sex with someone, this person come inside me, and I got freaked out. Can I go straight from the bed to the sexual health clinic tell what to do, would they prescribe me PrEP?
Yeah, as long as it's within the opening hours of the sexual health clinic, they will. But
yeah, okay.
yeah,
Otherwise, I could go to the A&E, I guess.
absolutely. So I think with PEP, the sooner the better. So if you start it earlier, I think there have been studies that show if you start it within kind of 24 to 48 hours, the outcomes are even better, and the effectiveness of the treatment is pretty high. And even within 72 hours, it was pretty high. But anything after 72 hours, there was like a significant drop in how effective PEP is. So the kind of benefit and risk, like the benefit did not outweigh the kind of risk or whatever. So, 72 hours is unfortunately the window. And after 72 hours, people would not be given it.
Yeah, you said that after 72 hours, people will not be giving it. Are there any other reasons why a doctor might not prescribe PEP for someone that thinks that might be at risk?
Well, I mean, so everyone before the doctor prescribes them PEP gets an instant HIV test, at least in a sexual health clinic. And obviously, if that instant test comes back positive, then PEP wouldn't be prescribed. If they've gotten a 5-day course from, say, A&E, but on further kind of risk assessment, it's felt that actually the risk was very, very, very low, almost negligible, then there would probably be a discussion with the patient and the doctor or the nurse about whether PEP is really indicated, and they may or may not then decide to, not continue the course.
Yeah. Will and I were talking earlier about the risk assessment that we've done. And my fear as well, when I had sex with the guy and he didn't come inside of me, but I still thought, oh my God, am I in danger? If I told that to my doctor, or to you even, supposing you were my doctor, would you still prescribe me PEP? What would be the risk assessment for a situation like that?
So, it's really interesting you asked that, because this is the exact situation we see like every single day. And it's, it's kind of, there's a few elements. There's like the risk assessment, which is based on evidence, which we can say, did someone have anal sex? Was there any bleeding? Was it forceful? Was there any trauma? Did someone come inside? So these are all, and being bottom, for example, in a homosexual relationship, sexual act, relationship, whatever that event is these are all kind of risk factors, right? But if someone had just topped, for example, and with a condom, but the patient's still scared, PEP may not necessarily be indicated, and it's really about kind of managing that anxiety. And I think HIV anxiety, especially in men who have sex with men, is a very real thing, and like we need to take our time to kind of address that in the clinic setting, and when people come for PEP. Sorry, I don't know if I've answered the question. I kind of feel like I went on a tangent.
I think you did, actually.
Okay.
Maybe, yeah. There is a risk assessment. You're going to ask many questions, like there was bleed, was it forceful? What was that?
Yeah.
What was going on? So you can better assess. That's what I understood.
Yeah. So basically, the questions that would be asked are, what sexual position were you? Were you top? Were you bottom? Were you both? Did someone come inside you? Did you come inside someone else? Was there any drugs or alcohol involved? Was it consensual sex? Was it group sex? Was it a regular partner? So basically anything you can think of. Also, obviously, like the partner's status, if you're aware of it, whether they're on PEP or PrEP, but often we take that with a grain of salt, because I think people who come through our door obviously aren't sure, even if someone is on PrEP, what their status is, etc. So.
Yeah. Now, I think I can go back a bit on the A&E subject we're talking about. Do you believe that healthcare professionals outside the sexual health sector have enough awareness and education about PEP?
Awareness, yes. I think healthcare professionals will know what it is, or I hope so anyway. But other than A&E doctors and sexual health clinicians, and I suppose infectious disease doctors, I don't necessarily think that any other clinicians really prescribe PEP on a day-to-day basis, or really ever. And they may not need to necessarily. So if you're going to a cardiologist's clinic, they may not be prescribing your PrEP, but it is important for them to know what PrEP is and why someone might be on it. I think, these medications are still relatively new compared to, say, medications for diabetes or high blood pressure. But which means that there is room for education and for improvement even in the healthcare world. But I think overall the knowledge is good.
And Monty, can anyone take PEP?
If it's indicated, yeah.
Like, just for clarity, for all different groups and demographics and everything. If someone felt like they needed it, could they ask for it? Or could they?
As in, if someone felt like they needed PEP, so as in, I don't know, I'm not getting the question. So if someone wanted PEP, would we just give it to them?
I meant like, could anyone take it? Would it be compatible for everyone to take?
Yeah, I mean, like I said, there's some kind of multivitamins, for example, that may interact with PEP. So if someone's taking those, then, and obviously the clinician will decide, ask, whether the patient has any allergies, whether they're taking any other medication, any other supplements, and based on that, probably advise. But yeah, pretty much everyone can take PEP. It's a pretty harmless drug.
Okay.
Obviously has a lot of benefit.
That kind of helps lead into the next question, which is what are the side effects of PEP?
So like any medication, PEP will also have some side effects, but the most common, like by far most common side effects are a bit of nausea and a bit of tummy upset, which usually settles within a couple of days. In my experience, I've never heard of any other side effects, really. I think in rare cases, there have been reports of some damage to the muscles and stuff, but I think that's also been secondary to perhaps the patient taking other medication that may interact with the PEP. But I don't know, you guys mentioned earlier that I think you both have had PEP before, so what side effects did you experience?
I haven't had any side effect.
I remember feeling a bit sick, like in maybe like the first couple of days, and then after that it was fine. But like it was pretty intense in the first day. I remember that.
Yeah, they tend to settle in like 4 or 5 days after you start, and it's a 28-day course, so 5 out of 28. Dealing with the nausea with the benefit of being protected, I think is.
Yeah, there's this question that if someone has side effects, should they just stop taking it?
They should speak to they should call the clinic. There's often a phone line, and they can probably advise what to do, and can probably advise that the nausea should settle. Ultimately, obviously, no one can force an adult to do anything. We can just present the evidence, and we can say, well, yes, nausea is common, and unfortunately, this is the only PEP that's available, and this is the evidence. If the nausea is becoming unbearable and you decide you want to stop, then you may, but this is the risk of kind of HIV and that sort of thing.
And when you finish the course of PEP, do you get tested for HIV and STIs?
Yes.
Cool. And from my own experience of taking PEP in the past, is as well as like I guess the experiences of people that I know and that have taken it, the whole process can be quite like anxious and like really stressful. And is there anything that we can do to like alleviate the stress around getting HIV, or how can we be kind to ourselves kind of during this process?
I think about this a lot. And I think recently I went back to my country in Pakistan recently, and I saw a couple of patients there, and I realized, even over there where awareness and knowledge of PEP and PrEP isn't really that good. HIV anxiety is a very real thing, or even knowledge about risk, you know?
Mhm.
And I think in certain communities, for obvious reasons, like levels of anxiety with regards to HIV are really high because of the stigma maybe that it was associated with in the past. And I think one way to kind of dispel the anxiety, and feel free to correct me or argue with me if you don't agree with this, but I think one way to dispel the anxiety around HIV is to kind of think of it logically. It's not different from any other chronic health concern that people may have, in my eyes anyway, like diabetes or high blood pressure. Because if someone does get HIV and they're on treatment and their viral load is undetectable, then they cannot pass it on to anyone. Their life expectancy is exactly the same, if not better, than the average human being. So why are we stigmatizing it? Why are we so fearful of it? And I think it all dates back to the 80s, for example, when HIV was a new thing, and it was known as the gay cancer, or I don't know, and like religious organizations, cultural organizations kind of saying that this is God's way of inflicting terror on non-heterosexual populations. And I think, and obviously by no means am I saying HIV is not a problem at all, so go and have casual sex and don't take PEP. Of course not. But I think a good way to eliminate the anxiety is by talking about it and by rationalizing that actually and educating people, and just rationalizing that actually it's not different from any other viral or chronic infection. It's
Yeah.
It is,
It's true. I feel like it's stigmatized from like it's stigmatized now today because of, I guess, the past. But things are very different now. I mean, obviously, it's still really difficult to be living with HIV and to have to take treatment, and to the stigma that comes with that. But it's an entirely different place to where we were like 30 years ago.
Yeah, and I think, again, I'm very happy to be corrected, but I think one of the biggest aspects of the difficulty in living with HIV is probably the kind of social stigma that's still associated with it. And I think, especially as you guys with your platforms, your social media following and outreach, and us as healthcare professionals, I think it is very much our job to be educating people about what HIV is, and that it's not a death sentence. It's very normal. It's it's okay. And hopefully, with time, these conversations will help alleviate anxiety a little bit. But it's a slow process. It's obviously not an overnight thing.
Yeah, because you're saying that if you alleviate the anxiety related to HIV, the anxiety related to taking PEP and other treatments will come along.
I think so. Maybe it's a very like fantastic fairy like Disney kind of view of the world, but
I agree with you. Actually, I think the same way. I think if we manage to tackle stigma, all the other things will become it will be lighter.
Yeah.
I mean, if you think about it, injecting insulin every single day is probably slightly more traumatic than taking a pill every day. So, that's not really stigmatized. Not that it should be, absolutely not.
Yeah.
But that's not stigmatized. Why are we stigmatizing this?
Yeah.
That's true. I think well, it's because of who HIV tends to affect, or predominantly affect, and how they're seen in society. Yes. That's a whole other, as Mark Thompson would say, that's a whole other Oprah Winfrey show.
I know, I could talk about that for hours.
So my next question is I guess a lot of the times within sexual health we see that sometimes the HIV prevention tools are pitted against each other. Like you see that it's sometimes condoms versus PrEP, or like it's testing versus, you know, there's always like I feel like there's sometimes competition around it. And like how important would you say that PEP is in terms of combination prevention within HIV prevention as a whole?
I think it's exceptionally important. I don't necessarily agree with you, Phil. I don't think we pit the things against each other. I think HIV prevention, the way I look at it, is very much like a 5-pronged star. So, you know, I hope it's 5 now that I'll count it. So it's like PEP, PrEP. If you can plan your sex and you know that you don't like using condoms and you know you're having risky sex, then PrEP. Okay, and it's not that you have to take it every day. You know, if you're good at planning your sex, you can take it event-based. But again, that's a whole different conversation. PEP is for those who are not on PrEP and have been exposed to what they think is a high-risk situation. Condoms obviously are a great method, but I know that a lot of people in the men who have sex with men community, especially in big cities like London, New York, etc., aren't huge fans of condoms, which is okay. But condoms will protect against a lot more than just HIV. So, and then also regular testing, like every 3 months for sexually active adults is recommended. And that obviously leads to, if you're regularly tested, if someone does test positive for HIV, then starting treatment early means that they'll become undetectable early, means they're less likely to pass it on to someone else, and they're aware of their status as well. So I think it's very much like, it's very much a combination thing, and I don't think one is superior to the other. I think they all kind of work in tandem. The other 6th thing, I guess there's 6, that I think is super important actually is having open and honest conversations with your sexual partners about what your status is, when you were last tested, whether you're on PrEP. Again, I think that helps to kind of alleviate the hesitancy and the stigma around HIV and makes the situation just a bit more comfortable. Yeah.
And you're saying that, pardon?
No, I said I'm done talking.
Oh, yeah, you were saying about the combination prevention, and especially that you don't believe that they fight against each other, they don't compete against each other. But I was wondering if has PrEP become less relevant as more people take PrEP?
Relevant is an interesting word. I wouldn't necessarily say it's become less relevant. I think it's very relevant. I would say maybe it's less common, but then you have to bear in mind that a lot of people, even let's just take London, for example. A lot of people who are taking PrEP are people who are aware of sexual health services, who have the knowledge of what PrEP is, who have, usually don't have kind of cultural barriers that prevent them from coming to, or language barriers that prevent them from coming to and accessing sexual health services. Whereas those who don't necessarily, have those things, and often that's in people of color, in kind of more marginalized communities, in lower socioeconomic backgrounds, who don't really engage as much as, say, white men do in sexual health. And I think for them especially, PEP becomes more important because, if they feel like, yes, there's an argument to say if they're not aware of PrEP, how will they be aware of PEP? But, if they're scared enough to have experienced a situation where they think has put them at risk of HIV, for example, sexual assault, they could go to A&E, they could even Google it, and a simple Google search might point them in a certain direction. But ultimately, I think we need to become, I know I'm like kind of segueing here, but I think, again, as healthcare providers and yourselves as kind of influencers, I think we need to become much better at engaging the more marginalized populations in these prevention strategies. And I think that really needs to be kind of at the forefront. But in answer to your question, no, I don't think PEP is irrelevant. I think it's very relevant, especially for those who can't ask. Especially, even until a couple of months ago, people had to pay for PrEP. It's only recently become free on the NHS. And again, there are obviously gay and bi men who are having sex in lower socioeconomic brackets, and they may not be able to afford, PrEP for a month costing $60 whatever. So, yeah, we need to be better.
It's really interesting you mentioned about the people from other ethnic groups that live here, because they might not know how to access PrEP. They might think that PrEP's not for them, but they know, or hopefully they know, like migrant people, that A&E is something that they can use, because I think for migrant people, there's a lot of stigma related to accessing health in general.
Mm-hmm.
So it's interesting that you said that, because I haven't thought about that PEP is still very relevant for people who still have hard time accessing or don't know much about the health system. And I was wondering as well, I know, but now I'm talking a bit more about PrEP, is can you access PrEP the same way you can access PEP? Can you get PrEP on A&E, for example?
No, because if you think about it, PrEP is not an emergency drug, okay? So it's a preventative drug, and it needs to be taken before the sex, right? So if you're aware that you're having sex, but you've run out of PrEP, then use a condom or don't have that risky sex. But no, A&E is not going to stock PrEP.
Okay. So we're going to put later on the comments as well, guys, places that you can access PrEP, some clinics in London that you can access PrEP. And I think that's very useful as well, because if that's the way for you, you find a place to start the taking PrEP. And also that last question I'll make for you, probably, I don't know, I won't promise that, but the last question I'll possibly make for you actually came from Will, who just showed up earlier on that episode. And I thought it was a good idea, but I wonder what you think about it. The concept of emergency PEP at home. Do you think this is a good thing to consider, like having at home emergency PEP just in case?
I feel like my answer is going to be slightly controversial to this, but I'm going to say no. I don't think it's a good idea, because, like I said, if you think you're going to be involved in risky situations, that's literally what PrEP is for. And if you have been in a situation that has been, say, non-consensual or forced, or drugs were involved, then it's probably likely that you should see a doctor or a nurse practitioner anyway to kind of help you and counsel you through that. And I think that's why it's probably best to get PEP as an emergency.
Yeah, we have another question here popping up. We have a question. Do you think someone visiting a high HIV incidence part of the world should take PEP with them?
No, if you're on PrEP, then that's fine. I'm assuming this is not like a medical professional who's going to like be doing surgeries and stuff in a high incidence population, because in that case, then the hospital will have PEP for you if in case you need it. But if you're going to a place where prevalence of HIV is quite high, and you're planning on having risky sex, then just take PrEP.
Yeah. Because PEP, as you said earlier, is slightly different drug. So you can't really replace one for another. Let's say I have PrEP at home, I had sex, but I thought, well, I was using event-based PrEP, but I forgot to take it. Now I had sex, the person come inside me, I'll just take PrEP instead. Can you replace one for another?
No.
Like that?
No, you can't. And like also there, I remember, I think this will be too much detail, so we won't go into it. But there have been cases where, someone has been on PrEP, but they've missed a dose or two, and then they have sex, or they're on PEP, and then they have sex again, unprotected sex, and it's like it's very difficult to kind of risk assess and make that judgment yourself. Unless you're trained in being able to do that. So I think it's really important. If there's any doubt, go to a clinic, go to A&E.
Don't
self-medicate.
Okay. And in the research paper you wrote in the Lancet HIV on I guess on people taking PEP during the COVID-19 pandemic, the amount of PEP in sexual health services has gone down. What are your thoughts about that?
Okay, first of all, I have to say I didn't write the paper alone. I wrote it with my bosses, and all credit goes to them, okay, because they are amazing. So yes, so what we were looking at was we were just studying the rates of PEP during the first wave lockdown, which is when we assumed that people were being the most fierce because COVID was new and lockdown was a new concept, and it was all very unknown and very scary, which is probably why there was a reduction in PEP, because people were probably having less sex. But there was also a hypothesis that it may be that, those who are having sex, and those who are having risky sex may not be attending the clinics for a lack of awareness of it being open, and B, for a fear of judgment. And I think Dean Street I'm biased. I love Dean Street, obviously, because I've worked there. But I think Dean Street did a really excellent job at kind of using that as an opportunity to launch a social media campaign and say, this is the great time to test for HIV. Our doors are still open. If you are having sex, yes, we know the lockdown rules and stuff, but, if you need to access PEP, please do come and see us. We're not here to judge you. We're just here to help you. So, yeah, I think knowledge is power, basically. So I think hopefully it was more that people weren't having sex, and therefore the rates went down. But in the event that they were, I think we made a really proactive effort to kind of educate people through Instagram and Twitter and stuff. And I think the power of social media is, undeniable. I mean, this is social media too, isn't it?
A lot of all of this is social media. So do you feel like if hypothetically, if the issue was that people are having sex but they weren't traveling and accessing PEP, would there be any other ways to address that?
No, I think just like I said, making sure that the information is out there, that people are aware that the services are open, that people know that they can access PEP and PrEP and all that without being judged for having sex during lockdown. And I'm not encouraging breaking lockdown rules and having random sex. People I'm indifferent to that. But
okay. Not promoting that anyone break lockdown, but if you are, there's a bunch of information on the PrEPster website on what you can and can't do. And
absolutely.
So, yeah. So I guess the last of our questions. Thank you so much for answering them. I'm sorry if they were tricky at any point or we put you on the spot. We're gonna share. Oh, there's another question. So the question is, why is PEP, I guess, taken for 28 days? And does PEP still work for shorter blocks of time?
So the answer is no. So there was some research that was done, when PEP was first being studied, and they looked at different intervals. So I think it was, I'll need to look at the paper, but I think it was 5 days of PEP and then kind of 10 days and 28 days. This was all, bear in mind, obviously doing this on human subjects would be entirely unethical. So it wasn't done on humans, it was done on animal models, but very, very closely replicated. And it found that anything less than 28 days, the efficacy of PEP significantly decreased to the point where it was less than 50% effective. And, you know, obviously, like if you think about research, ideally research needs to be kind of, you know, you take a cohort and you give someone PEP for 28 days and you give someone else PEP for 5 days and see the follow-up. But that is completely unethical and would never happen. And so because we can't really do amazing research for PEP, the kind of safe option is the best option. I am not encouraging anyone to do that kind of research. Absolutely not. Just take the 28 days if you're offered it.
Keep it safe.
So we're going to share links to the paper, also a link on PEP and another link on how to access PrEP in the UK. But are there any other questions from the audience? We're going to take that as a no.
No,
Yes?
yeah. And guys, if you have more questions, we'll just share with us the email. You can contact us. We can, there's a note that pop up on the screen. So yes, the email that you can contact us to ask more questions privately is outreach@prepster.info. It's showing up on the screen right now.
And I guess now it's time for the tier system.
Yes, time for the tier system. Welcome. Don't there you are, Monty. The tier system. You know, I'm already, you know, getting ready here. You know, getting comfy on my sofa because you need to be comfortable now, really, because the tier system is a game that involves answering very, very personal questions about sex. There are 4 tiers, and the higher the tier, the more personal the question. We created this game because we wanted to normalize and destigmatize talking about sex and sexual health. And there is a question for you, Monty, and one for the audience. And we might do one for Phil and I as well today, since it's the last one. What do you think, Phil?
I think we should do it with us instead of the audience this week.
Okay, let's keep in the family. Okay, so Phil and I will join the game this time. And so yes.
It doesn't matter.
I was going to explain how you do to participate, but guys, today is just us, you know. So I'll randomly get one piece of paper in the Prepster hat, and let's see what comes out. And there will be the question. Okay, it's tier 1, which means that it's not too bad. Tier 1. But don't get yourself fooled. It might still be quite, you know, intense. Anyway, during lockdown, would you rather drink alcohol but never wank, or to wank but never to drink alcohol? Assuming that you drink alcohol.
That is so easy. I would wank and never drink alcohol because I don't drink alcohol.
I wouldn't know how to answer, actually. I think I would still wank as well. I'll keep wanking.
I think the pleasure is probably better. I don't know.
Exactly. And sometimes, you know, it's my coping mechanism. I couldn't, you know, sometimes I needed it.
Yeah.
Anyway, Phil, it's your turn now. Is that okay?
Yes. I'm just hoping.
Yes. Oh, God. Phil, you got a tier 2.
Okay.
Which might be very hard for you to answer, though, because your boss is on the call. Have you ever had a wank at work?
This is actually an interesting one. I have never wanked at my club. Because actually,
allegedly,
no. The toilet. It's not doable. There's no privacy. There's no I wouldn't do it in our current place of work. But I have previously at every job I've ever worked at, besides Sainsbury's. So yeah, didn't happen.
I love it.
That's
Okay, my
awesome.
turn now. My turn now.
Tier 4.
Let's see. Tier 4 is quite bad. Oh, it's a tier 1. Oh, that was easy as well. When was the last time? Fun.
You too.
Okay, well, I'll take another one. But I can answer that. When was the last time you were tested for STIs? And it was really recently, actually. I think it was March or February. March or February. So yeah, I'm still in my 3 months window until I can order another test kit. I live in Greenwich, so I have to use the Greenwich Sexual Health. It's not SHL here, but that's fine. And I'll take another one, and that's for all of us. Let's do that.
Oh gosh.
No, not.
I'm gonna pass.
Monty sparked. This one is just for Phil and I. Oh, whoa! What?
Wait, I can't hear you. No.
It was the pressure, you know, the pressure of the environment was so tense.
Okay.
This one is a romantic one. It's a tier 1. It's very romantic. You might be able to answer that, Monty. You choose.
Go for it.
When you make out, do you like to leave your tongue hard or soft?
My tongue?
Yes.
I feel like I have to do it on the side and then... I think it depends on the vibe.
It depends on the vibe. Okay.
And also, no one likes a washing machine, but no one wants like a limp tadpole either. So I think somewhere in the middle.
Somewhere in the middle. How about you, Phil?
I think I'm soft.
I'm soft too. I'm soft, and sometimes I'm a big wash machine guy as well.
Maybe some people like it.
Yes, let's hope. Let's hope for that. I feel like, as you said, you know, it takes two to tango, right? So you have to get the sense of how the person is kissing, and then you kiss like
yeah.
Sometimes
I swear to God that there were a couple of times in my life, especially since I moved to this country, that I had to stop and say, can you make your tongue soft, please? Because it's really frustrating when it's like a sword inside your mouth, you know?
What do you mean a hard tongue? I'm so confused.
It's like, I would do that, but if you're listening to the podcast, you won't be able to see what I'm doing right now. Okay. Yeah. And then you do like that.
Okay, do it soft.
Hmm?
Do it soft now.
I don't think that's how you make out.
Pardon?
I don't think that's how it works. I think you're doing it wrong.
Am I doing it wrong this whole time?
I don't know.
Well, I think after me putting my tongue out, we had enough. I think we had enough. I think I went to a new low in this TV show. You know, not TV yet, guys. Let's see what happens on season 2. We never know.
Pedro has big
we were exposed. Is that for real, Will? Do you want us to answer that?
Good for you.
I don't even know what that means, and I've worked in sexual health for like 2 years now.
It's really important that you know them, because we must.
I don't think you can get an STI from doing it.
Can you get an STI from 2 banging?
Possibly, I don't know.
I need to Google it. I need to see.
I'll explain to you, because this program is to inform people. Toe bang is when you use your toe inside your penis.
What?
No?
My housemate just responded.
It's not that?
I thought it was something else.
What is
you'd have to have a gigantic urethra to be able to get a toe inside there.
Is that in the urethra or in the foreskin? What are you talking about?
No, what are you talking about? You're using that in someone. Is it anal? You're the active. You're the top. using your toe instead of penis to bang someone.
Why are you so normal about this? I've never heard this in my life.
Yeah, me
Just
neither.
casually.
Okay, so what is toe bang then?
I don't even want to repeat what I feel.
I couldn't understand you.
I think we move on.
Yeah, that's beautiful.
Yeah, let's move on. Let's move on.
Oh my god.
That's a good one. And the only way to go from here is to say bye from you, Monty, because I'm sorry that I put you through this.
No, it's been a pleasure and learning curve.
Yeah, so thank you so much for joining us and for for being so honest. You answered 2 questions tonight. We normally only ask 1. So thank you so much.
Thank you.
You're very welcome. Thanks for having me.
For doing that, and I think we will take you from the stream now. Thank you. And Phil, what did you I was going to say, what have you learned today? And you learned a new way of toe banging someone, apparently.
I didn't think that was what I was going to be saying today, but that's what
I'm so sorry, Mom. I'm sorry, Dad. I'm sorry, Monty. But that's...
Okay, what did you learn today?
Yeah, you start, please.
No, I learned about toe banging. What did you learn today?
I learned today that you actually only receive 5 pills, 5 days of treatment on A&E. I didn't know that.
Yeah, they give you some of it at the beginning.
But that's good to know. That's information that I'll keep in mind now for if I need PEP again.
See, it's good to do this because we're learning as well.
Yeah. So unfortunately, guys, that's all we have time for today. And that's also our last episode for this season. P&P is a space in which we can discuss different topics, including toe banging, within sexual health that we don't normally talk about. If we do another season, which parts of sexual health would you like to see us discuss? Please send us to the email that we shared earlier. Let us know in the comments as well, because we still have some time. The first 5 episodes are on our Facebook already, and as soon as we finish recording this one, we will also be there. We have one more episode. No, we don't have any other episode. But please join us. Yeah, we have no more episodes, but please join us the next time in season 2.
So we'd like to say thank you to our colleagues for getting roped into doing the tech behind the scenes and occasionally taking part in the tier system against their will. We'd also like to say thank you to every single guest we've interviewed and to every single person who have watched the show. It was great to have you it's great to have you all with us in the 6th and final edition of P&P this season, and I can't wait to see you all again next time. Follow us on social media at Team Prepster or on Facebook at prepster.info. Bye.
Bye.